Welcome to this Beyond Zero e-learning module on drug-resistant TB. This is one of the Wits RHI catch-up sessions, and this particular section will be focusing on the baseline evaluation and pre-treatment checklist of patients diagnosed with drug-resistant TB. So once we've diagnosed somebody as gene expert positive, RIF resistant, we have sent off our tests for confirmation, which may take a few days but may also take several weeks. And we need to get our patient onto treatment. Before we're going to start a patient on DRTB treatment, there's certain baseline evaluations and monitoring that needs to happen. Making a diagnosis of DRTB has huge implications, and this is not a diagnosis to be sitting on. Very important that any patient who's been diagnosed with drug-resistant TB, so has a RIF-resistant gene expert, must be notified, and that patient must be called to come in as soon as possible. If the patient does not return within 48 hours, it's important to actually contact your community healthcare workers or your WOBOT teams and to go out and find them. And very important to also make sure we already early on determine who else is in the whole household and start getting the ball rolling for having contacts traced. There's a pre-treatment checklist that we can go to start looking at all the different things that needs to happen before we can start treatment. And it's got 5 major components we're going to go through in a bit more detail. Firstly, we're going to have to confirm our DRTB. We've already spoken about that, to send off our DRTB reflex test on a sputum. Secondly, our growth monitoring. Thirdly, doing the health status of the patient, which includes HIV and pregnancy. 4, to have bloods to help us monitor adverse events of the various medications we're going to start. And finally, specific special investigations that are also going to help us both monitor the progress of the patient, but also for future adverse events. On our algorithm for managing patients with RIF resistance, they have actually given a nice little summary of all the baseline visit evaluations that will need to happen. And this includes your growth monitoring. Very important that we must know what the weight and the BMI was before we start on treatment. And this will be one of the key indicators we will use to help see if our patient is managing well clinically. We also need to know about important factors of the health that will influence both the regimens we're going to choose and how we're going to manage the patient. And HIV testing or screening is probably one of the most important factors that's going to have an impact on the outcome of that patient. In women, it's very important to know if they have pregnancy, as it will change the way you're going to choose your regimens. And we also need to know about issues such as alcohol use or other factors that might be impacting the MDR-TB treatment. DRTB has a whole set of baseline bloods that need to be taken. And most of these we are going to be using as a way to determine whether there is adverse effects because of medication. So that includes a full blood count, which can be affected by medication, but also gives us a clue of how sick our patient is. Very important to monitor the kidneys in these patients, urea, electrolytes, serum creatinine, serum calcium and magnesium at baseline. All patients will have a TSH done, blood glucose, and some baseline on the liver. If your patients are well and you've got no other concerns, we will just do a baseline ALT. Patients who have history of liver disease or excessive alcohol use or are not very well, you might decide to do a full LFT, and remember to do a hepatitis B screening. This might be important in terms of our use, for example, of ARVs. And then there's specific special investigations we would like to do. So all patients need a baseline chest X-ray, also to help monitor as particularly worsening over time. And all patients need a baseline vision test, also to do with monitoring medication. Very important, our patients who are going to be on injections will be receiving very ototoxic medications, and they all need to have a baseline audiometry. And then lastly, for patients who will be on bedaquiline or delamanid, and now in the new regimen, also patients on clofazimine will be needing an ECG to look for the QT interval. All of the ways of interpreting these results and following them up will be covered in a lot more detail on our presentation on the side effects of DRTB treatment. Of course, we've now looked at a lot of the practical aspects of it, but we must not forget our patient. One of the important aspects of starting the path is getting the patient to actually agree to treatment. And before we can do that, there's a lot of counseling that needs to happen for this patient to start understanding what the implication of this illness is. And I think it's always difficult. We do not want to scare our patients, but we want them to be able to engage in quite a long process of treatment. And there's high expectations of our poor patients of all the things they're going to have to bear and do during this time. So they need to know what their rights and their responsibilities are for the treatment. They need to understand about hospitalization, if it's going to be relevant and how long that might be, and the importance of DOT. They have to understand the possible side effects of the medication. They have to understand why their families are going to have to be contacted and the preventing of the spread of this disease. They need to be offered all available support services, and they need to understand how is the treatment schedule going to work, the issues around injections, the monitoring that's going to happen, what we're looking for. And this is an extremely important key part at the beginning of the journey to ensure that our patients will actually manage to complete it. This is an example of the standard consent form that is available, and it also reminds us of all the different things we must ensure we have covered with our patients before we start treatment. So let's quickly summarize the things you need to think about when a patient is RIF resistant. We need to register and notify our patient. We need to send confirmation testing. We need to counsel and obtain treatment consent. We have to do a comprehensive history. We have to do a proper physical examination. We've got all those baseline investigations and testings that I've mentioned. And very importantly, we need to start our patient on treatment. Thank you. Please see some of our other modules in this particular section on the definition and diagnosis of DRTB, on the regimens, as well as using of ARVs in patients with DRTB.